conferences. So my name is Ricardo Pereira. I'm a PhD candidate. I'm in my second year of law, my PhD in law and government at Dublin City University. I'm also a member of the DCU Conflict Institute. And today I will start by presenting part of my PhD project that is related with the collective securitization of COVID-19 by the European Union. In this work, what I'm arguing for is for the use of organizational learning to compensate what collective securitization lacks in terms of explaining the routinization process. But first of all, I like to do this question in every single presentation that I do. That is, why is still relevant to study COVID-19 nowadays? And first of all, regarding the exceptionality of the threat. So regarding the number of deaths and multidimensional threats that the COVID was in terms of cyber, in terms of health, in terms of social and economic dimensions. At the same time, we had this lack of cooperation, coordination at the international level, here specifically within the EU. And we need to remember that indeed the EU has union in its name for something, right? Even in terms of historic memory. At the same time, there is a gap in the literature, because usually when we look to EU health, we look through a perspective of integration, but we lack a certain approach of security, to understand health through a security lens. So I'm trying here is to converge these three themes to see what results from here, even though now works from Oscar Fernandez and other people from EU Health Gov Network have already covered in part this gap. So this is my theoretical framework. There is my research question: to what extent did the EU collective securitization of COVID-19 drive the integration of EU response to the pandemic in the health domain between 2020 and 2025, even though the pandemic ended in 2023, but the aim of this research is to identify if the practices that emerged from the EU response to the pandemic, if they were integrated in the union structure or not. For that, I argue that the model of Sperling and Weber of collective securitization, based on the work of Aiken Williams from 2007, if I'm not wrong with the date, needs a certain reformulation in the last step of the model, when they talk about the routinization of new practices, new policies, new vocabulary, and new agenda that creates a new status quo within the organization. So here I argue for the addition of certain terms from organizational learning to identify how actually routinization occurs. And for that, I argue that in the recursive interaction step, we need to look to how the member states and the EU actors codify and do advocacy regarding measures to be applied to respond to threats. And in the routinization step, I argue for to look to this sub-process, like dissemination and training, to identify some micro practices that can emerge from this response. In this way, now we can conclude by arguing if we had a single or a double loop learning. So in this way, if we have a change in the status quo of the organization or a mere change of practices. For that, the aim of this project is to do an engaged research approach with an interpretativist methodology based on document analysis, elite interviews, participatory inquiry, and discourse analysis. For now, I have already collected 52 speeches from the European Commission to analyze what action were took regarding the threat. And here I will try to just be quickly. This part is just to understand if indeed this reform or this emerge of new practices occur within the EU structure by applying this engaged research idea, that is, bring politicians, practitioners, and academics together and make them actually active research participants in our project. So in this way, I will start by build a trust and network with these actors, and then we engage with them through interviews and focus group to then bring these communities together to actually do a dialogue group and understand perspectives and specificities of each community, and in this way to create, I would say, a general approach to the case of emerging of practices within the EU health domain. So here is a brief analysis of speeches from 2020 to 2021, where I identified 5 phases where the EU respond to COVID. I will try to be quick in this section. Through discourse analysis, we can identify discourse strategies like the demonization of the pandemic, the criminalization of the pandemic, the creation of us and them. At the same time, we can identify some some games of numbers, some metaphors, some hyperboles that they use to actually to securitize the COVID net, not just only as a health threat, but at the same time as a multidimensional threat. Here I'm talking about as a cyber threat with infodemics, that Borrell coined this term relating the fake news that emerged in the middle of 2020, and in 2021 when Ursula von der Leyen started touching the COVID-19 with climate change by saying that indeed we need to, in terms of the EU, we need to look to health threats in a comprehensive approach and to address this through a one health policy in all domains. In here, I would just mention some practices that have emerged. Here you have an idea what is the rescue strategic stockpile, and I highlight in red in the terms of using health, but in military terms. So there we have the actions of the EU to actually defend or to support Ukraine regarding CBRN threats. This is important because during, I would say, from 70s, 80s, when the Union start responding health threats with Europe against cancer and then with Europe against HIV, we can say that indeed the EU has an approach regarding health, but even though we know that this competence is shared and it's a weak competence where states continue to have power, so when we have this type of cases where the Union can create and coordinate this kind of structures, we need to be at least impressed. Another point is this biocontainer in Rwanda. It was part of the deployment of EU capabilities to support third countries. But in here, I need to do some critiques regarding the lack of cooperation between the EU and these countries, because in terms of know-how, the EU refuses to share this kind of know-how, and even in terms of logistics, there is a lack or underdevelopment of this logistics. So people that are in rural areas or in the periphery hardly will receive this kind of support. And I need to mention at the same time that these biocontainers are not just responding to COVID consequences, but at the same time other kinds of disease like HIV, just to mention a few. So as a conclusion, here I would like to highlight the capacity to characterize the COVID-19 through securitization as a global health crisis. More than that, the more stable approach regarding the securitization conducted by an international organization compared with its member states, in this case in the European Union. And at the same time, if we look in detail for the construction of threat and the construction of security, we can identify that is an inconstant characterization of the threat. So we have waves where we can identify that the COVID-19 is identified as a brutal threat, But at the same time, we have waves that we can see that COVID-19 is constructed as an existential threat, so discursively constructed. But in the opposite side, when we talk about security construction, we have a constant construction of the EU as a health security actor. And we arrive in 2021 with Ursula von der Leyen coining the term that the EU is the pharmacy of the world. Well, I will leave this to your imagination, but to continue. The Commission also took advantage of this window of opportunity to actually debate the competence in the health domain, but the conflict between Russia and Ukraine kind of stole the spotlight for this debate, and it's almost abandoned. Let's see what will happen with the new health program in 2026, 2027. But for now, what we can see is just a convergence between health and cyber. And to conclude, in terms of theory, if we can see this recursive interaction happening and empowering the Commission with symbolical and representative authority to answer in a coordinated way to an event, so we can agree that collective securitization emerged as a possible theory to look to international organizations as securitizing actors. I hope we balance the time now. Thank you very much.
Thank you, Ricardo.